My name is Anjeanette Brown. I'm a fellowship trained breast surgeon. I deal with breast cancer as well as diseases of the breast. So we have benign breast conditions as well as cancer. So one of the things that I have incorporated into my practice and into all of our practices at Premier Surgical Network is we like to use a prehab approach. I think it's essential. My patients have less complaints. They have a quicker time to resuming their normal function.
They are more than just a cancer diagnosis. They are a human being that has jobs, families, hobbies, activities they want to get back to, and we are just a part of that journey with them.
Because now we're dealing with a patient who had a visit before the actual surgery. Then they had the surgery. So now we have someone who has already consulted with the patient. They're already comfortable. We have the surgery. We have documentation of where the patient was before, so we know what our goal is afterwards. So the incision at the breast is actually not the incision that most patients complain about. It's actually the incision in the axilla. It's a much more sensitive area. So what I like about ReVital and what I like about the fact that we have a prehab and then we have rehab is that if a patient has an incision under the arm, you don't realize how much arm movement that you do on a regular basis. If you're a fully functioning patient who runs marathons and weightlifts and does CrossFit, and then after surgery you can barely lift your arm, that's debilitating. If I've sent you to rehab or prehab, we know where you were, then our physical therapists on the back end are able to get you back to that function.
Instead of just saying, them thinking, oh, this is my new normal. This is not their new normal. This will be their new normal once we get back to that. There are some days that the patients come into me and they are able to kind of open up a little bit more for me. It's more a comfortable and relaxed setting. We're exercising, we're telling jokes, they're telling me a little bit about their life and before cancer. So things the barriers come down a little bit. You can 100% have a patient come in 1 to 2 years after they finish their treatments because of those long-lasting effects. So it's this course of not just during their cancer, it is a lifelong relationship with me, so then that way they are the best that they can be.